Jai Hind everybody. In continuation with the implant surgical videos of Perio Subharti, today's short video would be on sinus lift curettes. So in one of our earlier videos, we have covered up the armamentarium, that is piezo surgery used for sinus lift, and we have covered up the second armamentarium in one of our shorts, that is LAS kit for sinus lift. After these two preclinical videos which are available on our channel, we have two implant patient videos also. In one, we have shown how in a patient we have used piezo surgery for sinus lift, and how in a short we have shown in a patient how we have used the LAS kit. Now these four videos which are there on our channel have basically focused on the cutting of the window part of direct sinus lift. What we haven't focused are the curettes part. So a common query is that which are the sinus lift curettes that we can use and how are we supposed to use them in our direct sinus lift surgery. So let us have a look. So this is basically our armamentarium. We have the four basic sinus lift curettes, two initial ones and the two later or deep use ones. We'll be demonstrating the use on an artificial or dry model. So basically a dry model is different from a wet model which is of natural animal tissue. And in this model, we have the advantage that it is a clean model. Demonstration is easier in this model. However, it has two disadvantages. Firstly, this material, that is acrylic. If I am making a video of cutting of bone in this model, the feel of bone won't be there. That is the first disadvantage of an artificial model, that is dry model. Secondly, the rubber polymer which mimics the membrane, that is too fragile in this case. So the chances of perforation of the membrane are quite a bit in an artificial model. So from a demonstration point of view, artificial model is better. From a hands-on point of view, a wet model is better. So in this model, we have already made the window to save time. The dimensions of the window basically are determined by the LAS kit or depending on the site which we are planning to augment. So basically the base of the window should be 3 to 5 millimeter from the base of the maxillary sinus floor. So if my sinus base is at 3 millimeter, the width is 3 millimeter, this base has to be 3 to 5 millimeter above that particular base of the sinus. So the advantage of that 3 to 5 millimeter is that once I am lifting it, I'll be able to condense my bone graft inside. So the first part is already done, the part where window preparation was done. Now I am supposed to start with the lifting part. So for lifting part, I have my two initial sinus lift curettes. So be it the initial sinus lift curettes or the curettes which we are supposed to use later on. The difference between these curettes and a normal periosteal elevator is with regard to the edge. So we have a sharp edge in the case of a periosteal elevator, while in the case of sinus lift curette, basically the edge is supposed to be blunt. So this is the difference. So this is an instrument which has much more life as compared to a periosteal elevator, because sharpness is not the issue. It is basically the shape, and the purpose is to lift it as gently as possible. So with regard to the two initial curettes, preference has to be there, like whichever one which you feel comfortable you can use initially. I feel comfortable with this instrument. So once this instrument I am supposed to apply after window cutting, and for that I am supposed to insert it and very gently try to move it inside. So when I am moving it inside, the important thing which I have to remember is that my tip has to be in contact with the bone always when I am moving it inside. So if I am moving it like this, I am supposed to keep it in contact with bone, and then I am supposed to rotate it like this. This is the initial curette. Now the same thing if I have to take deeper, now I have to shift from the initial sinus lift curette to basically a more acutely angled curette. So the advantage of this curette is
I'll be able to insert and I'll be able to take it deep like this. So once I'm able to take it deep, I have reflected the Schneiderian membrane to a large extent. So always I have to lift it like this. I don't have to lift it like this. The final thing is that now even if I have lifted it from the base, from the sides it has to be lifted. So for lifting it from the sides, we have the final sinus lift curette. We have two sides. So one side would be used for the anterior side and the other side would be used for the posterior side. So anterior, that is mesial or distal side. So this is basically the sinus lift curette which we are supposed to use for lifting the sides. So this was just a short video in which we tried to show the difference between initial curettes and the final curettes or the deep curettes. After lifting, of course, then with the help of a bone graft carrier, we are supposed to put the bone graft inside.
So this was just a small demonstration with regard to sinus lift curettes. I always say this thing, that in the current scenario, just being a periodontist is not sufficient. We have to be a peri-implantologist also. But what does being a peri-implantologist mean? Does it mean treating cases of only peri-implantitis, that is implants placed by others? The answer is no. As a peri-implantologist, we need to be able to place implants in situations where other people are finding it difficult to place. So two procedures we should be thorough with. One is direct sinus lift and another one is GBR or guided bone regeneration. So in our next video, we'll be covering up the parts of a GBR tag kit. If you have liked this video, do like and subscribe to our channel. Jai Hind.